High blood pressure. Why is it important? Well, high blood pressure is also known as a silent killer, and a lot of times people don't present with any symptoms. So it's important for us to always follow up with our primary care provider to make sure that the blood pressure is not too high. So what is considered high blood pressure? Prehypertension or high blood pressure is when the top number is greater than 120 but less than 130. And stage 1 is greater than 130, stage 2 is greater than 140. Depending on the stage and depending on the symptoms, you may need to be treated with lifestyle changes, sometimes medications, and sometimes following up to make sure that something else isn't causing it. So, lifestyle changes, what are these exact things? The first one is exercising. You want to get in at least 150 minutes of moderate intensity exercise, minutes every single week, whether that's 3 to 5 times a week. If you're doing high intensity exercises, you can cut that down to 75 minutes per week. Why? It decreases the risk of heart disease, decreases the risk of type 2 diabetes, stroke. You live longer. What else can you do? Nutrition. Nutrition is key. The Mediterranean diet or the DASH diet, diet basically is the acronym into dietary advantages to stop hypertension, something like that. But the reason that this is also important is it focuses on reducing the amount of salt intake, processed foods, red meat intake, increasing the amounts of, the lean proteins, chickens, fish, nuts, and whatnot. The biggest thing is decreasing the amount of processed foods to help to stop the blood pressure from being so high. Next thing is stress. Wanting to get enough sleep, doing things that provide you a lot of relaxation, whether that's yoga, exercising, etc. You want to check some labs. Issues with potassium and magnesium can also lead to high blood pressure. Of course, you want to make sure that you don't have any underlying medical issues that would also affect this too. I find that a lot of people have high blood pressure due to underlying reasons. This is known as secondary hypertension. So things like sleep apnea, which is the most common undiagnosed or undertreated. Things like issues with the thyroid, the adrenal glands can also be affected. So making sure that you're following up with your primary care regarding that to make sure that something else isn't causing your blood pressure to be elevated. Weight loss, significantly, a large percentage of Americans are overweight. So losing weight can significantly lead to your blood pressure dropping. Doing all of the above, losing weight, exercising, watching what you sleep, eating, getting enough rest, reducing the amount of stress altogether should be the only thing that you need to treat your blood pressure. But there are some people who, despite all of these attempts, continue to have elevated blood pressures. For these individuals, need to be on medications for it, especially if you have signs of damage to the body from high blood pressure. Damage in the sense of having issues with the kidneys, issues with the liver, issues with erectile dysfunction, strokes, TIAs, mini strokes. Those can all be signs of elevated blood pressure. So getting that treated with medications, if lifestyle changes have not worked, it would be the next advice. There are a lot of different medications that we can utilize. The most important thing is choosing the one that is right for you. Not all medications are going to be good for each individual. These medications, though good, do have their side effects associated with it. Some can cause ankle swelling. Some can cause issues with potassium. Some can even cause lip swelling and throat swelling. So you want to pick the one that's the safest for each individual, but also follow up and see how these lifestyle changes have been going. Have you been losing the weight you're supposed to be losing? Because for some individuals, if you're able to change your lifestyle while on medications, we can potentially bring you off these medications.